Hi, everybody. Welcome to our second live on Facebook. We're just going to give it a few minutes for people to pop on. As we begin this, if you guys have any questions, feel free to comment in the section below, and we will be sure to see those and respond to them live as we begin. So this is our second panel discussion series that we have started with the Center for Education and Advanced Care Planning. My name's Elleah Tooker, and as the Community Education Coordinator, we felt that it was important, especially during this time where we can't all meet in person, to still bring these resources to you. And what better way than via social media? So, like I said, this is the second one. We have Wendell Walsh and Steve Chupp today with us, as well as Hannah Nichols. So I'm going to just introduce them briefly and we'll go ahead and get started. So Wendell Walsh, he's served on the board of Center for Hospice Care since 2011. He's currently chair of the Hospice Foundation Board. He's also a partner with Mishawaka-based law firm May Oberfell Lorber. His practice includes estate planning, administration, advising people on nursing home related issues, such as Medicaid planning. So really his background is going to be wonderful in this discussion on all-encompassing end-of-life issues. He is retiring soon, so new clients will be referred to Nathan Barnes. We'll put his comment and information below as well. So if you do have any questions or want to reach out, you'll have someone to contact that way. Steve Chupp is the coordinator for Honoring Choices North Central Indiana. It's located in Mishawaka, Indiana. This is really a homegrown organization that started with some wonderful pillars of our community who saw the need for end-of-life issues. He provides advanced care planning for St. Joe, Elkhart, and Marshall counties. Previously, he was a trainer with a consulting firm for business and nonprofits, specializing in stress management. So really, his background will be insightful for some of the questions that we have today. And then, of course, Hannah Nichols, one of our own here at the Hospice Foundation. She's the Communications and Events Coordinator. She's joining us to help kind of facilitate this conversation. So any of the comments that I mentioned before that'll be posted below, any of the information, she's going to be in charge of that, and she'll also help guide so that any of the questions that you guys post, we'll be able to see them and react to them and answer them as quickly as possible for you guys. So without further ado, do you guys have any additional things you want to add about yourself before we get started?
Not particularly. Thank you for that introduction. Very good.
Perfect.
Same with me. I'm so delighted to be able to participate in this valuable panel discussion.
Yeah.
Thanks, Elleah.
All right, well, let's go ahead and get started. This all-encompassing idea of end of life, that can seem like a lot, right? So in your profession specifically, what should people be prepared to discuss when they come into your office? Steve, do we want to start with you?
Sure. The Honoring Choices program that we have specifically addresses advanced care planning. And so the emphasis on care and healthcare and the end of life, and how would you like to prepare for that? So the question that we address is, who would speak for you if you were unable to speak for yourself in a healthcare crisis? That's a very important question that comes up, especially today in a COVID-19 era. So who would speak for you? Who do you trust to speak for you, who would also understand your end of life wishes and what kind of care you would like to receive? So we think of that person as a healthcare representative. And the healthcare representative is somebody that you would choose and that you would trust and communicate with about what your end of life wishes are and how you would like to be cared for. And then if you've chosen that person, you would bring that person with you for our first consultation and conversation so that they would be aware of your wishes as we discuss them and what their role is. And so in addition to that, the kind of conversation that we would have with you would be, what are your goals and values in life in general? And then what interventions are acceptable and unacceptable to you as you would approach end of life. In other words, if you'd be in a healthcare crisis, what kind of care would you like to receive? And there are other kinds of care that you might say, I don't really want that done for me. But this is person-centered. You're the center of this. You're the one that makes those kind of decisions. So those are the things that we would address when they come to us.
Wonderful. So to get back to that, what should they be prepared to discuss? That idea of, just their goals and whom they might want to be in charge of their health care. Wendell, what is it like for people coming to see you? What should they be prepared to discuss?
Well, before someone comes to see me or Nathan Barnes or any other lawyer involved in estate planning, it's a good opportunity to do an inventory. What do I mean by inventory? Well, let's do a list of what we have, a list of our assets, various accounts and stocks and real estate and that kind of thing, and make sure that we have a complete list before we come in to see the attorney. Think through some ideas of who should be receiving those assets. Usually it's the spouse. If the spouse is not available or no longer living, then it would go to children, but it's also an opportunity to remember to make specific bequests, such as bequests to the Hospice Foundation, if I could make that plug.
Mm-hmm.
Think through who within the family would be the most appropriate person to be in charge of the estate. Clients who have little kids should think through who they would nominate through their estate plan to serve as the guardian of their children. And then also documents that can be prepared that can be helpful while we're still living. Who should be the agent under a power of attorney? Who should be the healthcare representative, as Steve was mentioning? And what kind of end-of-life wishes should we have? I think it's important for people to think through these things. For many, it's a question, it's a religious question, it's something to pray over. I think that process should begin before you sit down with the estate planning lawyer.
Wonderful. So something that I heard you guys both mention is some of these conversations and how important those conversations are to have even before sitting down with either one of you. So what are some things that people can ask each other, their family members, their loved ones, to kind of get access to some of that information before sitting down with you guys?
Well, the conversation is vital. You can sign all the documents you want to, but unless people within the family clearly understand your wishes, there's potential for problems. For example, someone signs a living will declaration, making it clear that extraordinary means are not to be used to keep me alive if my physician tells us that. And then some family member comes flying in from across the country and says, I don't care what that piece of paper says. Keep mom alive. And what is a doctor supposed to do in that situation? So having this discussion within the family beforehand and say, I've signed this and I mean it, and do not dispute it because these are my wishes. I'm going to take control of this situation. For some families, it's a difficult discussion to have, but I found that by sitting down with children and saying, don't freak out, we're not going anywhere, but this is what responsible people our age do. And we want you to know, we want you to be informed so that when the time comes, the entire family is ready.
It's wonderful to hear some of those pieces, especially about being on the same page. Steve, I'm sure this is right up your alley with what you guys do as far as some of the conversations go.
Yeah, it's very similar to what Wendell is talking about here. Families need to talk, and this is not, as Wendell's alluding to, this is not an easy conversation for a lot of people because they're thinking, well, is there something I should know? Are you about to die because you're bringing this topic up? But on the other hand, it's something that every family should talk about because whether a person is older or not, there's still the possibility of being in a situation where they're not able to speak for themselves. And while they're able to speak, they need to have the conversation with their family. So it's really important to be able to mention a couple things that are so important. One is their wishes, as Wendell said, very important to say, these are the kinds of situations in which I would like this kind of care or not like this kind of care. And then the other one is there shouldn't be a surprise in the end about who the healthcare representative is. If that person, once that person is appointed, the family has to have a conversation to say, here are my wishes, this person knows them, you know them as well, but here will be the go-to person for me in that situation who will be my spokesperson and make the decision for me and for my healthcare. And so those kind of conversations are so helpful to have ahead of time so that everybody's clear and there's no disagreement. There may be a disagreement in essence of what should happen, but everybody knows what you want, what the person wants, and that's been clearly communicated.
So, could I ask a question from your experience? Do you find that some people are concerned about offending somebody in the family? That is, gee, if I appoint my son as my healthcare representative, my daughter's going to be offended.
That can easily happen, and family dynamics play into this really strongly. So there is that, and that should be actually kind of anticipated, maybe not to a terrible degree, but at least to say, you know, when I announce this or talk it over with my family, I need to explain to them, I've chosen this person because I feel like they're in a good position to follow through on my decisions. These are my decisions, and they're in a good position to do that. There's no favoritism here. It's simply who would be in the best position to carry that out. And so explaining that ahead of time, it's much better to have a conversation ahead of time than having the surprise at the end.
Those are four important words. These are my decisions.
Yes, exactly. And it's not that way everybody can respect that person's decisions. And also, as a facilitator of that conversation, I do not impose my wishes. I make it clear many times, these are your wishes. I'm not leading you to a certain conclusion. I'm only explaining to you the options that are available to you and then having the conversation so we discover your goals and values.
Exactly. Well, something that you preemptively mentioned, Wendell, is kind of that misconception, that idea that whoever you choose will anger someone else in your family, which is a possibility, but should not deter you from beginning that conversation. So for both of you guys, let's start with you, Wendell. What are some common misconceptions that you face in your field, and how do you kind of combat those?
Well, everybody seems to procrastinate when it comes to end-of-life planning. That's pretty normal. We're human. We don't want to contemplate the fact that whether we're here 20 years or whether we're here 80 years, we're not here very long. And we have the opportunity to live each day to the full and also to look forward and have some control over our legacy. I think that people put off planning for a couple of reasons that really come to mind. And the first is, I'm going to knock my own profession here, but there's a concern about legal expense. People don't want to make the appointment to go in and see the lawyer because they're concerned they're going to get a humongous bill for an unknown amount, and whether they go forward or not. And I think that people should understand that this is the first portion of the process where you have control, where you can say, look, I'd like to come in and speak with attorney so-and-so. Is there a fee for sitting down with her to talk this through? And know what that is up front. And if it's something that you don't want to pay, then you move on to the next lawyer. Once we sit down with the lawyer, and typically that's done, by the way, I know in our firm, it's been done at no expense to the client. Then we talk about what would be involved in the estate plan. And that gives the lawyer an opportunity to give a realistic projection of what the cost would be. We do that. We don't charge a dime until we've got an agreement first. We are going to do a will. We're going to do a healthcare representative. We're going to do a power of attorney and other documents. And this is what we anticipate the fees to be. And this is the time frame that we're going to do it. If the client thinks it's too much or is uncomfortable in any way, they can go on to somebody else. Again, this is an opportunity for a person to take control over her own situation. And if we can get through that concern about legal expenses, I think more people would proceed with the process.
I think that's a great point. Steve, do you face that same misconception?
Yeah, we certainly do. And in fact, when we're talking about end-of-life medical care, there are unfortunately way too many misconceptions out there. For example, a lot of people think that advanced care planning is only for extremely ill or old people. And so they think, okay, I'm so young, why would I even think about that? But on the other hand, we know that as quickly as an accident can happen, or especially in COVID-19 era, if somebody's on a respirator that they are not going, or a ventilator, they're not able to communicate. And so those are things that we need to be aware of. Another one, and you know, in our situation, and we're not in competition with law firms at all, we're serving very complementary roles in this. And that is that our services are free, and we have 35 volunteer facilitators who are able to meet with people at no charge. And so that's another misconception. This is going to be an expensive process. But a couple other quick misconceptions people have is that advanced care planning can only be done by a lawyer and notarized. I think it'd be great if people could go to a lawyer, maybe set up their advanced care documents, and then come to us and have a conversation about what those mean. And because it's one thing to set it up, but as Wendell's talking about too, it's so important to have the conversation. One other misconception that I would mention is if I complete a living will, I'll not receive treatment in a crisis. And a living will is only very specific to certain situations. It's not about what would happen to you when your life is not on the line, when you are near death. It's simply something that points, a living will is only for those situations and wouldn't restrict any medical treatment in any other situation.
Well, it really sounds like your two fields are very complementary to each other, and that, you know, by sitting down with someone like Wendell and getting all of those documents done and having a conversation through Honoring Choices, that really sounds like a dream team, doesn't it?
It really does work that way. Yeah.
I think Honoring Choices is a wonderful resource for anybody in the community, especially our seniors. I just wanted to point out that if I can tell a quick story, I am the healthcare representative for an elderly relative who, because of a medication error, had his blood sugar level go very low, and he was unresponsive in the facility where he was located. And so I was faced with the idea that, you know, they're saying maybe he had a stroke, he's unresponsive. I'm the healthcare representative, I'm aware of his end of life wishes. What do I do? I did not think it was extraordinary to call an ambulance to get him to the hospital and find out what was going on. And lo and behold, they found that his blood sugar had gone so low that that was explaining his symptoms. And after it was over with, I sat with him and said, here's what was going on when you were unresponsive. And I just want to make sure that I did the right thing by you as your healthcare representative. He said, absolutely. So you can't cover every possible contingency of what may or may not happen. A lot of it is just common sense. And in that situation, it worked out. He's still with us, and he's about to be 95 years old. So,
well, those stories are the things that really help clarify. You know, for an individual like me at my age, why should I get this done? Well, that story that you just told, Wendell, is for anyone at any age because he lived beyond that. So those documents came into play at a very specific situation when he was not able to speak for himself. But then afterwards, you were able to say, here's what I did as a healthcare representative, and have a further conversation about it. And I think that that's so important to identify that idea that this is not just for end of life, in the sense that I am old, I've lived a wonderful life, and I'm going based on these situations. You know, we live in a society and in a world where unfortunately we're not able to know when or where we're going to pass. And Steve, you've mentioned COVID a few times, and I think that's not meant to scare any audience members watching, but really to identify the fact that this is important to do now. If you are 18 and older, begin those conversations now, because it's only going to continue as you get older and your decisions may change, right? Have you guys faced that yourselves? What are some personal experiences that you've had to face with your families, perhaps in your field?
Every major change in our life should lead us to look again at our estate plan. When we get married, if we get divorced, when we have children, when we're approaching retirement age. All of those are opportunities, not necessarily to definitely change the estate plan, but at least to look at it.
Yeah, exactly. And as you're saying, Wendell, there's kind of mile markers every 5 to 10 years. There's another one. Has nothing to do with your health, has everything to do with your life circumstance, because circumstances change. For example, Wendell, you being the healthcare representative of that individual, the older relative, put you in a great place because you were in a position where when those crises hit, you're fine with making that decision. Those are the kind of things that we need to think about with a healthcare representative. It could be that over a period of time, you might change your mind about your healthcare representative. They may not be available. The relationship may change. And so that's another one that's good to think about and to keep updating. These documents are not static. They do not need to stay the same, and they really should be reviewed to make sure they still reflect your first choices.
Wonderful. And it looks like we have an audience question. So not sure, Hannah, do you want to pop on and ask that so that our panelists can respond?
Sure. So you guys are already touching on advanced care directives and when to start that, but an audience member wants to know, what are the first steps for filling out an advanced care directive?
I would say in advanced care directives, the number one form that you want to fill out first is, as we've been talking about, is the healthcare representative. There are two forms that we especially focus on to begin with: the healthcare representative form and then the living will. And the healthcare representative is so important that you choose that person early on. And even more important than just filling out the form, however, is, as we're talking about, having the conversation. Having the conversation is actually more important than filling out the form. Because it's actually possible in the state of Indiana to choose a healthcare representative, fill out the form, and the healthcare representative does not even know that they've been chosen because they don't need to sign the form. So the first and most important thing is the healthcare representative, but informing that person as well as your family members, the rest of your family members, if that person is a family member, what your wishes are, and having the conversation. And then going to that form, these are simple forms. The state of Indiana has very simple forms. They don't even need to be notarized, but beginning with the healthcare representative and then moving on to the living will, but most importantly, having the conversation about what's reflected in those documents.
I forgot to mention earlier that a document such as a healthcare representative appointment form can be flexible in that more than one person can be mentioned. I advocate for designating one person with another person as a backup. So for example, if a daughter is designated as the healthcare representative and she is on vacation at Disney World when the time comes that a decision needs to be made and can't be reached, and the son is there locally, the son can step in by signing a simple affidavit which we also provide as part of the process. I do not encourage families to have joint healthcare representatives or joint agents under a power of attorney, because if there is a falling out between the two children, for example, then there's a danger that nothing gets done and no decision gets made. So give the authority to one person, and if that one person is not available or can't serve for some reason, then have a backup.
Yeah, that's something that we strongly emphasize as well, Wendell, that sometimes people say, well, I want to be nice or I want to be fair, so I'm going to appoint two family members as co-representatives or healthcare power of attorney. Well, that gets very confusing. We discourage that. But we also encourage, as you're saying, a secondary person in case the initial person is not available. Now, I do have a question for my legal counsel on this Facebook Live. Is a healthcare representative the same as a broad power of attorney in regard to other aspects of their finances?
It is not. The power of attorney document refers to the financial aspects of a person's life, and the healthcare representative gives authority to someone in the appropriate circumstances to make health decisions for that person. It's an important distinction. I'm glad you brought it up.
Yeah, I think that is important, because sometimes we actually talk about, it is referred to sometimes as the healthcare power of attorney. That's kind of unfortunate language, because while they do have authority to make decisions in those certain specific narrow guidelines of health and healthcare, and in certain situations when the person is not able to speak for themselves, and only then, it's not related to the rest of their finances and estate.
That's a great point that you mentioned. You know, that's something I think we all wonder about at one point in our life is, well, if I have someone over my estate and over my finances, well, then they can just decide everything for me. And understanding that there's a difference between those two is so important. I'm sure you get that question a lot, both of you guys.
Yes, we do. Yeah, it gets confusing for some.
Well, especially when the client is a senior citizen, I stress the importance of keeping control as much as you can. You don't have to hand over control to anybody, especially when you're talking about the wealth that you've built through hard work throughout your lifetime. If you designate someone as your agent under a power of attorney, for example, on the financial side, that should be merely as a convenience of someone who can take care of things for you if you, because of your health or some other reason, just can't do it on your own. But we're very, very cautious about it. You know, I tell people, once you sign this power of attorney and designate Sonny Boy over there as your agent, realize that he can clean you out tomorrow, which sounds very, I guess, maybe it comes across as being a little bit too emotional. But we've seen cases in families where tragically there's drug abuse. And unfortunately, that drug abuse leads someone to rip off his or her parents in this fashion. So we're always on the lookout for any possibility of financial abuse of our seniors. And lawyers feel a responsibility to be alert to that. And if I encounter it in my practice, I'm certainly not going to be a part of it, and I'm going to do my best to stop it.
Well, I think you hit another misconception there as you were speaking, that, you know, really lawyers or, you know, Steve, with what you do, filling out these advanced care directives, you're not doing it for yourself. You're really doing it with the best interest of the community member in mind. And that's something that may help with some misconceptions and some people who haven't called yet, that this is really about you and your wishes and your finances and your end of life. And all of those encompassing end of life issues really begin and end with you and your wishes, and that you can surround yourself with individuals like an attorney who can help take care of that for you. And that can almost be an added comfort, right?
Exactly. I think that instead of people thinking about this as a dreaded conversation, I think the approach can be more with the view of the end in mind. And so, for example, yes, we're going to have this conversation. It may be a little uncomfortable to start, but it's going to lead us to the peace of mind that we are going to have, as I'm going to have that as an individual, with when I have that conversation with my family, and my family will understand where I'm coming from, what my values and goals are, and my wishes are, and I will have the peace of mind that my wishes will be carried out. So if we think about it in those terms, this can really create a sense of confidence and tranquility in a way of calming any anxiety we might have about what would happen at the end.
Yeah. Well, kind of jumping off of that, what are some personal experiences that you guys have had? I know, Wendell, you've mentioned one or two that, these are compelling arguments in a sense. So what are some personal experience that have influenced your thinking about end of life planning?
I had two very contrasting experiences in my life. One was my grandmother, my maternal grandmother, Grandma Olson. And when she passed away, she was 92 years old, but just before she passed away, she contracted pneumonia and was unable to speak for herself. And so she was on a ventilator. And so what happened was my mom, her two children that were in the area at that time, my mom and her brother were out in the hallway trying to figure out what to do and to make a decision. And so my mom did not want to allow a natural death. And my uncle said, look, mom's already gone. Let's just let her go. And nobody was in a position to know what grandma's wishes were. And it was an agonizing decision that finally my mom abdicated to my uncle. Now, contrast that to a conversation we had with my father before he died. My father had a few illnesses, and one of the things that happened toward the end of his life is he had renal failure, kidney failure. And so he went on dialysis, but he was not handling the dialysis well. It was not working well for him. And so I remember a Thanksgiving dinner, actually, that we had. We have a large family. He sat everybody down and he said, I need to talk with you about this. What should I do? And we had this wonderful conversation where there were two things that were going on. He wanted to know how we felt in order to make a better decision about whether to continue dialysis. And he wanted us to know how he made that decision. He eventually made the decision to go off of dialysis. We had a wonderful 5 days in his home where we were saying goodbye, and everybody was fine with the decision we made. What a wonderful conversation that we had. And those two stories really propelled me to say, folks, let's have the conversation. Let's talk about this so that people know our wishes ahead of time.
You know what really brought this to the head from a legal perspective is the case of Karen Ann Quinlan, which was a few decades back, and some of the senior members of the audience will remember Karen Ann, who fell into a coma, and a major dispute developed between her fiance and her parents. Each camp feeling that it was important to keep her alive or allow her to go. And nobody knew what Karen wanted. And so there was this long drawn out legal case, and nobody was happy except the lawyers involved, who made a lot of money on it. And then I think that case and others like it sparked us as a society to say, why don't we give people the power to have control and express their wishes before it gets to that point? And that is part of the peace of mind that Steve talked about earlier that comes with thinking these things through and making our feelings known.
Yeah, how wonderful, that peace of mind. What a great little almost soundbite in the sense that that's really what you gain from having these conversations, that while they may be difficult initially, that overall peace of mind is so worth a difficult conversation.
Well, I think the peace of mind also is for the family. They might be uncomfortable with the discussion, but when all is said and done, at the end of the talk we have every year in my family, my sons know that if something happens to me, mom's going to be okay. And here are the numbers. And this is where everything is. And y'all are going to be in charge of making sure that her day-to-day needs are all set. But from a financial standpoint, mom's going to be okay. And that's very comforting, I think, to children in that situation.
It really is. You know, as a child myself, I think that that's extremely comforting to the idea of knowing that whichever parent were to go, there's a plan and there's something in place, and that plan is so, so comforting. You know, kind of leaping off of that idea, you know, where should these plans be? Should I put it in a, you know, safety deposit box? Where should I put these plans to make sure that they're accessible for my family?
That's a really great question. And especially with advanced care documents, it's so important to have those accessible. And so with a healthcare representative with a living will, those should not be put in a safe deposit box where they're going to be stored and nobody will be able to get to them, especially in the event of an illness. There are several places that you should really have your advanced care documents. One is actually with you. Many people encourage others to have them in their cars, so that in a case of an accident, the emergency workers are going to immediately know who to talk to. Another one, of course, is with your healthcare providers. You want your doctor to know that, so you take it to your physician, your primary care physician, and your healthcare provider, and give them copies of that document. Of course, family members should have that. And interestingly enough, there's an app called Milo, M-Y-L-O, Mind Your Loved Ones, where people can actually put these on an app. Spouses can have these, and you can have these accessible. You can even email them to others. And those are some places to have the apps or the documents. The most important thing to remember is these documents need to be accessible, and people need to know where they are and how to get to them.
The only person I would add to the list is the lawyer keeps one too. In case somebody loses it, you've got a place to go to get it, and you don't have to reinvent the wheel.
Yeah, that's very important. In the event that people don't know where they are, they may call the lawyer first.
That's amazing. Yeah, an additional resource right there. Your car, your lawyer, everybody in between, it sounds like, which is wonderful. You know, don't hide these documents away. And Wendell, one thing that you mentioned, which I think, Steve, is pretty similar to the advanced care documents in themselves with the healthcare piece, is that you'll revisit these. You know, so you really have a relationship with your attorney, or, you know, with Honoring Choices, with these conversations, because you're going to continue to have these conversations, whether you get married, divorced, children out of college, children before college, all of those different pieces. This sounds like a continuing conversation.
And you know, Elleah, sometimes people ask the question, well, if I decide to change, for example, my healthcare representative, how do I do that? Well, in a way, the initial aspect of that is it's as simple as tearing up the document, because you can create a new document with any changes in your living will or your healthcare representative. However, it's not really that simple, because if you tear up that document, create a new one, and don't put that in the places where it needs to be, discuss that with your lawyer, talk about that with your healthcare provider, talk about that with your family, no one's going to know. And so it's very important that when you do change it, that you update that with the significant people around you. In fact, sometimes people actually take the original copy and will write in there, no longer in effect, or whatever term they want to use to point out this was the original one, and submit that one. But the important thing is to get the new one with the new date on it.
Great advice.
Wonderful. Is there anything else that you guys would want to leave our audience members with today before we finish up this live?
One thing that we could mention, because it's come up often, is, okay, how do we do this in a COVID-19 environment? Is it possible? I mean, if we can't meet one-on-one, there may still be possibilities of meeting one-on-one actually, but we also provide a virtual platform for people to fill out these documents. And so we can meet like this with a video involved. We can do it with telephone, with Skype, with Zoom, with FaceTime. There are a lot of ways that we could do this. It does get a little tricky, but it's totally possible to work out the signatures and make sure everything, the witnesses, and get all that verified. But it is possible, and you don't need to wait until this COVID crisis is over, pandemic, before you can start filling those out.
I'd just like to refer to our friends at Center for Hospice Care, which is affiliated with the Center for Education and Advanced Planning. And we see the Center for Hospice Care constantly telling us, what kind of care do you want today? The focus is on you. And so what we've been talking about for the last hour or so is, what kind of financial plan do you want? What kind of provisions do you want to make in terms of appointing a healthcare representative? And we have organizations and we have attorneys who can assist you in accomplishing that. You just need to make the step and get over those hurdles that we talked about earlier to start down that path of planning, and that planning leads to peace of mind.
Well, thank you both so much. A lot of this information gives our audience members somewhere to go. I think as a final thought, as we all leave here today, is what conversation are you going to begin today? What action and step can you take within our community with your family members to begin this conversation for that peace of mind that we discussed? What are you able to do? Who should you contact if you have additional questions? And all of that will be linked below for our two panelists today to get more information if you have additional questions. But really, that first initial step of starting the conversation, I would love to hear from any community members that see this now or at a later date, how they began those conversations, and comment that below. And we'll be watching to see how many of you guys take that challenge on. So thank you so much to both of our panelists today. Steve, Wendell, it's wonderful to have some trusted advisors here to help guide this conversation in a way that's constructive. Any final things before we say goodbye?
Thank you so much for having us on and highlighting the need for this. And again, I would just, reinforce the fact that we are working in partnership in the community. The Center for Education, Honoring Choices, attorneys, we have a great partnership to serve the needs of people and to make sure their wishes are expressed and documented.
Just grateful to the Center for Education and Advanced Planning for presenting this and other presentations to help people.
Well, thank you so much. Hannah, thanks for helping moderate some of those community questions that popped up in the comments section. And that's going to be it for today. Tune in next Thursday. We will have another live with further questions revolving around end-of-life planning.